In the heart of the American healthcare system, a system trusted to care for the sick, the vulnerable, and the elderly, a sprawling, invisible heist was underway. It would become the largest healthcare fraud takedown in U.S. history. A staggering $14.6 billion, yes, billion, was siphoned off by hundreds of doctors, nurses, medical staff, and corporate executives. And for years, no one noticed. Then, in July 2025, federal prosecutors dropped a bombshell. 324 people were charged across the country in an unprecedented sweep of arrests that spanned 35 states. The operation was swift, coordinated, and ruthless, executed by the Department of Justice, FBI, HHS, and state agencies in what they called a coast-to-coast crackdown on greed. At the center of it all, a sickening web of fake medical billing, fraudulent prescriptions, kickbacks, and bogus patient services. Here's how it worked. Some doctors billed Medicare and Medicaid for treatments that never happened. Cancer therapies, HIV medications, and surgeries for patients who didn't even exist. Others prescribed opioids in exchange for cash, running pill mills disguised as pain clinics. In Texas alone, a single medical clinic falsely billed $250 million for genetic tests that were never conducted. In Florida, a mental health center pocketed $98 million while housing patients in inhumane conditions. And in California, lab owners paid bribes to doctors to refer patients for unnecessary blood tests, then billed the government 10 times the real cost. The fraudsters exploited every loophole imaginable. Some even hacked into hospital billing systems to forge claims under real patient names, without them ever knowing. The DOJ uncovered fake hospices, bogus home health services, and shell companies posing as legitimate providers. In some cases, patients were in on the scam, receiving kickbacks for their Medicare IDs. Authorities seized millions in assets, luxury cars, gold bars, private jets, and crypto wallets. One defendant had hidden $400,000 in cash behind walls in his mansion. Across the country, investigators froze $245 million in fraudulent payments before they could be laundered. But behind the headlines and dollar signs lies a darker truth. Every stolen dollar was meant for real people. For cancer patients who couldn't afford chemo. For seniors denied care due to budget cuts. For hospitals forced to close wings while fraudsters thrived. This wasn't just financial theft, it was moral theft. U.S. Attorney General Merrick Garland called it a direct attack on the most vulnerable members of our society, committed by those who vowed to care for them. The $14.6 billion healthcare fraud takedown isn't just a story of corruption, it's a warning, a look into how greed can infect even the systems meant to heal. But it's also a testament to what happens when the system fights back. Hundreds now face decades in prison, billions have been recovered, but the damage still being counted. And the question that lingers is chilling. If this is what we caught, what else is out there?